Heart sounds are closed by the opening and closing of the valves, as well as turbulence in the ventricle. The heart sounds that I'm most interested in you knowing for physiology are heart sound 1 and heart sound 2. Heart sound 1 is the classic lub, and heart sound 2 is the dub that people hear when they're listening to the heart with a stethoscope. The lub, or first heart sound, is due to the closing of the atrial ventricle valves. As a reminder, that occurs, if we look up here, the atrial ventricle valve closing, that's the mitral valve on the left side of the heart. And so when that closes, it vibrates, and in that vibration we can detect that, we can hear that. The other heart sound then is heart sound 2, that's your dub, and that's to the closing of the semilunar valves on both sides of the heart. And again, if you take a look at where this happens, here we have the aortic valve shutting, here again, and the pulmonary valve on the right side of the heart would be shutting at the same time. Those are the two most common sounds that can be heard when listening to the heart with a stethoscope. Two other sounds exist. There's a third heart sound caused by the turbulence of blood at the very beginning of ventricle filling. So this is at the very beginning, as the ventricle begins to fill with blood. It's normal to hear this in children, but it's not that common to hear it in adults. It might, in adults, indicate something called ventricular dilation, which would be the enlargement of the ventricle, which would then cause the sound of the filling of blood, the turbulence created by that to, echo's not quite the word, but vibrate in the enlarged chamber of the heart. The fourth heart sound is caused by the turbulence of the blood at the end of ventricle filling. So one is at the beginning and one is at the end. And it's due to the force generated by the atria. It's heard during atrial systole. And this is usually due to ventricular stiffness. It's not uncommon to have both enlargement of the ventricle and stiffness of the ventricle wall at the same time. In fact, ventricular hypertrophy, if we were to consider, for example, just kind of a ballpark, we're going to do a rough sketch. This is a ventricle, we'll pretend. Okay, if this is my normal size, then enlargement of the ventricle would occur often in response to acute stress, or not so much acute, but chronic stress created by things such as high blood pressure, obesity, although we also see enlargement of the heart during in extreme athletes as well. And so the enlargement of the heart then would be as so. But in addition to that enlargement, and this would only be during, conditions of stress, like I mentioned, high blood pressure, obesity, heart disease of some sort, we would actually get these ventricular walls to thicken. And as damage accumulates in those ventricular walls, the fibers, the contractile fibers, are damaged and replaced, sometimes with scar tissue. And so that accumulation makes this ventricle less likely to stretch. It becomes much harder for it to stretch and fill with blood. And so there's more resistance to the last 20% of blood that's being pushed into it by the atria. And so that can be heard with the fourth heart sound. And again, so third and fourth, it's unlikely that you're going to hear this if you go to lab and you're practicing in the lab. You're probably not going to hear heart sound 3 and heart sound 4 because, like I mentioned, they're not commonly heard in adults unless there's possibly a pathological condition.